In developmental behavioral pediatrics, we see kids with developmental concerns like autism or just general developmental delays, so speech and language delays, fine motor delays, gross motor delays, social delays, as well as it encompasses more behavioral concerns like ADHD, big temper tantrums, early child mental health concerns, which can look a lot like just temper tantrums. Then we also see kids with learning concerns, so things like learning disabilities in reading or math, as well as intellectual disabilities. Our visits can sometimes be a little bit intimidating. I think there's a lot of anxiety around coming to see one of us for the first time, and I think that I want parents to know that we realize that. We really spend a lot of time gathering information. We have really long first visits because we have so much to gather. We really take a look at the kid from, before birth, prenatal history, all the way through where they are now. We do testing of various sorts. So testing of, for autism or for intelligence or school testing, regardless of whether they're able to answer questions directly. Throughout the visit, as I'm talking to the parent, I'm watching the child. And if they are verbal, then, I try and engage the child in multiple conversations and involve them kind of as much as they're comfortable with and as much as they're able to be involved in the visit. It really is key to include the parent in decision making and make sure they're kind of on board. Key ways that I try and do that is really just kind of meeting the parent where they're at. So kind of asking questions to determine what they know already about what's going on with their child and kind of where they're at in their understanding of what might be going on, what they're worried might be going on. The most rewarding part of my job is really just being able to interact with and care for patients and help families and patients to kind of achieve the goals that they have set for their child.